Greetings, everyone. Welcome to the first installment of the Echo Concussion video series. My name is Kristian Goulet, and I'm a pediatric sports medicine physician at the University of Ottawa Brain and Mind Research Institute and part of the hub team with Echo.
And my name is McIntyre, and I'm a physiatrist at Toronto Rehab and the University of Toronto, and I'm also on the hub team for Echo Concussion. The purpose of today's video is to provide a simple framework that you can use to approach the assessment and initial management of a patient with concussion. We created the acronym CLEAR to make it easy to remember, which we'll now go through.
The C in the acronym CLEAR stands for check for red flags. One of the things really important is to remember that a head injury is also a neck injury until proven otherwise. You definitely don't want to miss a neck injury when you're dealing with a head injury. So red flags when someone has suffered a head injury is any sort of signs of skull fracture that McKyla will talk about in a minute, repeated vomiting, worsening clinical signs and symptoms over time, any sort of seizure activity, an inability to control their urine or their stool, impaired vision, especially double vision, and any radicular signs, meaning any sort of neurological signs shooting down their arms or the legs. These are all things that would warrant close follow-up and monitoring.
The L of our acronym is for learn more about symptoms. When you're initially assessing a patient with concussion, the red flags Kristian just talked about would likely require urgent neuroimaging, such as a CT head. The Canadian CT head rule, which you can see on the screen, can be used for patients with blunt trauma and witness loss of consciousness, amnesia, or witness disorientation. And in terms of next steps, patients should receive written and verbal information about concussion before they're discharged from the ER, and they should be advised to avoid driving for 24 hours, as well as to avoid substances such as drugs and alcohol.
This next slide talks about kids and getting head CTs. We really do want to avoid as much radiation in kids as we can, and we have this PCARN pediatric head CT rule that you can see here below. This was designed as a template for doctors to determine when a head CT in kids is required. And it is divided in those less than 2 years of age and those kids 2 years of age and older. This is freely available online, and recommend anybody who's going to be ordering a CT checks with these guidelines before actually ordering one. So the E in our acronym stands for exercise. It used to be believed that after concussion, patients really needed to shut it down. More current literature suggests that delaying exercise can actually slow down recovery. So we do recommend early return to light exercise in a very controlled and safe manner after about 24 to 48 hours. Initial activities could include walking, stretching, and it's important that you don't do too much too quickly, right? And you do nothing that would put their head at risk of getting hit again. The adage, start low and go slow, is definitely appropriate when returning kids to exercise.
The A of our acronym stands for activity. So we want to emphasize the importance of getting back to school, work, and other social activities in a similar graduated fashion. It's generally safe to resume these activities after a brief period of rest that we want to be no longer than 24 to 48 hours. Be sure to ask your patient to monitor for any new or worsening symptoms that might be a sign that they're doing too much too fast. It's important to review pacing and advise that they should plan important activities for earlier in the day when they may have more energy and fewer symptoms.
So the R in our acronym stands for reassess. Close follow-up with concussion patients is essential to ensure an expeditious and safe return to activity. It is important to know that although we want kids to get back to activity as soon as possible, returning too quickly to certain activities, especially those high-risk activities, can result in longer-term injury and a delayed recovery from their initial concussion. It is important to know that kids should be back at school full-time without significant accommodations before they are cleared to return back to higher risk physical activity. It is important that before a kid goes back to full sports or full activity, they are cleared by either a physician or a nurse practitioner experienced in treating concussions.
So just to summarize our clear approach, be sure to check for red flags, learn more about symptoms to decide on the next steps in management, promote early exercise and activity after 24 to 48 hours, including physical and cognitive, and reassess by regularly following up with the patient and their care team.
For more information and to register for Echo Concussion, please visit the website listed there or to scan the QR code. Thank you so much for listening, and we hope to see you with the Hub team soon.